What role does deafferentation play in phantom limb sensation? Imagine losing a limb and still feeling it there, sometimes even feeling pain or movement. That strange experience is called phantom limb sensation, and it puzzles many. Today, we're going to explore how the loss of nerve signals, known as deafferentation, causes these phantom feelings. When someone loses a limb, their nerves that used to send signals from that limb to the brain are interrupted. This interruption is called deafferentation. It happens often after amputation or nerve injury. Without normal signals, the brain gets confused. Instead of shutting down the part of the brain that used to process signals from the missing limb, it reorganizes itself. This process is called maladaptive plasticity. The brain's map of the body doesn't just vanish. Instead, the area in the brain that used to handle the missing limb gets taken over by neighboring body parts. For example, the face or chest area might invade that space. This reorganization is closely linked to phantom limb sensations and even phantom pain. Deafferentation also causes changes at different levels of the nervous system. Near the site of amputation, nerves can fire spontaneously, creating erratic signals that the brain interprets as pain. Sometimes, nerve endings from neuromas, which are tangled nerve growths that send confusing signals. The spinal cord circuits become more sensitive, lowering the threshold for pain and making responses exaggerated. The brain's networks involved in sensing and controlling movement also change. This creates sensory-motor conflicts. The brain sends commands to move the missing limb but receives no feedback. This mismatch can intensify phantom sensations. Interestingly, research shows that the persistence of the brain's mental image of the missing limb is more connected to phantom pain than how much the brain reorganizes. This suggests the brain keeps a map of the limb active, even if it's no longer there. From a strange science point of view, this means the brain is essentially hallucinating the missing limb. It creates sensations and pain from signals that aren't coming from anywhere real. Experiments have shown that touching the face can cause sensations in the phantom hand. This happens because of overlapping brain maps. Another curious fact is that imagining moving the phantom limb can reduce pain. The more vividly you imagine moving it, the less pain you might feel. This shows how motor commands and sensory feedback are linked in strange ways after nerve signals are cut. Understanding deafferentation helps develop treatments like mirror therapy. In this therapy, a mirror reflects the intact limb, giving the illusion that the missing limb is moving. This visual trick can help reduce phantom pain by restoring some sense of normal sensory-motor connection. So, in simple terms, deafferentation sets off a chain reaction. It causes the brain to change how it processes signals, creating a vivid, sometimes painful, experience of a limb that's no longer there. The brain's ability to fill in the gaps with false sensations highlights just how powerful and quirky our mind's body map can be.